When working with patients, particularly those who are reaching the ends of their lives, paramedics and ultimately healthcare workers in general will often encounter clashes with patients refusing medical treatment that is against their best interests. For paramedics, the dilemma emerges when patients are aware of the consequences of their decision and continue to do so regardless, and the question arises, when do paramedics respect the patient's capacity to make their own health decisions, and when is that option unavailable for them? In this video, we will review Mr. Benson's case, as well as looking at the laws associated with refusing treatment, what constitutes a valid refusal, situations in which health attorneys will play a role, as well as the common laws regarding advanced health directives, all within the context of the PRECARE acronym. The problem identified in this scenario is that Mr. Benson has refused QAS treatment, however his daughter Jenny has requested he be treated regardless as she is his health attorney. Gaining the facts, it has been shown that Mr. Benson has had a recent history of central chest pain in the last few days during exercise, worsening today. QAS assessment has found that Mr. Benson may be experiencing an AMI and has suggested he accompany them to hospital for further treatment. However, he has refused as he has no desire to go to hospital, nor is he afraid of the consequences. He has presented an advanced healthcare directive outlining to withhold life-sustaining treatments, including CPR. Jenny was informed and she has requested QAS take Mr. Benson to hospital. Looking at the ethics of the case, Mr. Benson's right to choose the extent of the treatment he receives should be honoured, as there is nothing to indicate that he has lost the capacity to do so, and the paramedics should respect his autonomy of the case. His choice to refuse treatment may be causing some emotional harm to his daughter. However, it is inappropriate to consider forcing treatment onto Mr. Benson when that may cause actual harm to him if he resists. The paramedics have relieved Mr. Benson's pain, they have informed him of his likely condition and the possible outcomes of refusing to receive treatment, as well as contacting his daughter Jenny to help Mr. Benson to the best of their ability. For pre-hospital care paramedics, code of conduct is solely based around Queensland Health Guides to informed decision making, as well as the Queensland Ambulance Service Practice Manual subsection on patient decision making. Within the QAS clinical manual, these three elements of a valid refusal of medical treatment 1992 are highlighted as the decision is made voluntarily without duress or influence of either drugs or alcohol, the decision to refuse relates to the current circumstances, and the person has the capacity to refuse. The person having the capacity to refuse is a grey area in the code of conduct on whether the patient has the cognitive ability to justifiably understand the consequences of refusing transport or help. Capacity is defined as understanding the nature and the effect of the decision. This includes being mindful of alcohol, drugs, and severe pain, as well as being understanding of the gravity of the decision. Along with having the capacity to refuse treatment and transport, a person must first be deemed reasonably sound of cognitive function. According to the guidelines set by the Queensland Ambulance Service in the Clinical Practice Manual, the patient must pass a basic cognitive test to show that they are of sound mind and understand the risks. If they fail in this test, they can be deemed not sound of mind to make this decision and must fall onto the next of kin to make the decision. Lastly, paramedics must provide the patient with advice that will promote the patient's comfort and safety. They must also comprehensively document in the patient's record all relevant details regarding the attendance and the paramedic's assessment, and the finding that the patient's decision was valid. These are all legal requirements under the Code of Conduct that paramedics must adhere to when dealing with the refusal of transport or treatment. While the paramedics chose to respect the wishes of their patient and leave him at home, rather than try to force him to go to hospital to receive life-saving treatment, the argument exists that they may have made the wrong choice. Given the extreme, life-threatening nature of the case, the argument could be made that the safety of the patient supersedes their consent, especially given the daughter's position as his power of attorney, and the desire to see him treated. Additionally, the patient's stated grief could be considered as a conflict for consent. However, looking at the several key acts of legislation and the QAS policy and guidelines, these arguments fail to hold up. The QAS Clinical Practice Guidelines of 2016 lay out the procedure for patient refusal of treatment and transportation, and so long as the patient presents with capacity, defined in the Guardianship Act of 2000, the patient is able to refuse treatment and transportation. The daughter's power in the situation as her father's health attorney is also only applicable should her father no longer have capacity as per Section 62 of the Powers of Attorneys Act 1998, meaning neither she nor the paramedics have any legal power to disregard Mr. Benson's refusal of treatment and transportation. At common law, it is recognized that all competent adults can consent to or have the right to refuse medical treatment. under the Australian Law Reform Commission 2014. To abide by this law as a health professional, it is important to understand what deems someone competent, what informed consent and refusal entails, and what constitutes a valid refusal of healthcare. As paramedics, we need to assess that this capacity is not impaired in any way, including drug and alcohol influences, mental illness, and manipulation. It is part of our duty of care and a requirement of law outlined in the Medical Treatment Act 1988 to inform the patient of the consequences of their decision by providing them with information regarding recommended treatment and transport and the consequences of refusal. According to the Powers of Attorney Act 1998, a statutory health attorney is someone with automatic authority to make healthcare decisions on behalf of an adult whose capability to make healthcare decisions is temporarily or permanently impaired. A statutory health attorney can act if the person has not set out the relevant directions for medical treatment in the Advanced Healthcare Directive. An Advanced Healthcare Directive is a formal document in which a person can provide directions regarding future medical matter. Additionally, a patient's Advanced Healthcare Directive can only operate if the patient loses their capacity to make decisions. A patient who has impaired decision-making capacity, the order of priority for dealing with a health matter must be in accordance with the directions made in an Advanced Healthcare Directive. Or, if the patient has an appointed health attorney, the matter must be dealt with in accordance with their directions given by the healthcare attorney. Based on the information discussed, the fact that Mr. Benson has shown to have capacity, the situation has been explained to him by the paramedics, and he is in possession of an Advanced Health Directive that coincides with his wishes, the decision to withhold medical treatment and transportation must be respected. Even though Jenny is his health attorney, under ethical considerations, paramedic code, and Queensland law, Mr. Benson withholds the right to maintain control over his health decisions. In summary, we have discussed Mr. Benson's case using the PRECARE acronym, highlighting ethics, code, and regulations specifically to do with Advanced Healthcare Directives and Power of Attorney, and we have used these sources to come to a decision for Mr. Benson. While the paramedics and Jenny may not agree with Mr. Benson's wishes, the fact that he has proven capacity and understands the consequences of his decision, his right to choose must be respected.